Hello, my name is Karen Fells. As part of Teaching Strategies presentation, I'm presenting Intermittent Catheterization Protocol. This is my student and orientee, Samantha, and she will be doing a return demonstration of the demonstration on this mannequin for this procedure. Let's talk about the outcomes we hope to achieve. We want Samantha to have an appropriate return demonstration. We also want her to be able to identify 5 abnormal signs and symptoms she would report to the physician related to this procedure. So let's go ahead and begin. We're going to go ahead and skip the double identifier patient order check and explaining of the procedure as this is a mannequin and go straight into hand cleansing. So we would cleanse our hands for approximately 15 seconds or until they're dry, and then we would apply gloves. Non-sterile gloves. Okay? We're going to go ahead and provide privacy and shut the doors if this were a patient and then drape them. We're going to separate the external labia and visualize the meatus. We will take the first towelette with soap and water and cleanse in a downward motion. The next towelette will have just water to get the soap away. Okay? We're then going to remove our non-sterile gloves and re-sanitize our hands for 15 seconds. We will then open our sterile catheterization kit and remove the sterile gloves. We're going to go ahead and prepare our bag by removing the cap without removing the lubricant, and then reapply it back into the cap kit. If the patient were allergic to iodine, we'd forgo the iodine and use soap and water. We're going to open the iodine, remove all 3, and separate them. We're going to open the external labia majora and wipe in a downward motion and drop the bottom one. Then do the next one, and then the next one. Okay? We're then going to take our introducer straight into the meatus and advance 1 to 2 inches until urine is started to flow. Once it starts to flow, we're going to advance 1 more inch. We're going to note the color, the concentration, whether it's concentrated or diluted, whether there's any blood in the urine, sediment, cloudiness, if there was any resistance when we inserted the introducer, or if the patient experienced any pain. At the point at which the urine stops flowing, we're going to go ahead and coude the patient to the side. As we apply the pressure to the abdomen, we will pinch the catheter when we release, preventing backflow into the urine. Then we're going to go to the middle, pinching once again, and then to the other side. Once that's completely empty, we're going to pinch and remove the introducer, put the back into the bag, and we're going to note the amount for documentation, tie the disposal together, and dispose of it all. Okay? We're then going to clean the patient with soap and water to remove all iodine, just water, and then we're going to dry the patient. We would then re-drape the patient, clean our area, remove our gloves, sanitize our hands, and go and document the procedure. Have any questions? Okay. So let's collect your materials and begin.
We'll first walk into the room and make sure the patient has privacy, pulling the curtain, shutting the door. We'll introduce ourselves to the patient, explain the procedure. We will wash our hands for 15 seconds with hand sanitizer. We will apply non-sterile gloves. We will have checked the physician order to make sure this is the correct procedure and the correct time frame. We will undrape the patient. We will separate the labia Majora. With the soap and water wipe, we will cleanse. With the water wipe, we will wipe the soap away. And we will dispose of our non-sterile gloves. We will then use hand sanitizer again for 15 seconds before we go to our sterile catheter kit. We'll make sure as we're preparing our kit that the patient is not allergic to iodine. We'll remove our sterile gloves. Making sure that
The gloves don't win.
the gloves don't in. Make sure that we don't touch the outside of the sterile gloves.
Alright.
We will then make sure we have everything in our kit. We will go ahead and get our catheter ready. Taking the lid off. And making sure that we have the end that's lubricated still intact. Put our catheter back into our sterile field. Again, we make sure that the patient's not allergic to iodine.
And if they were, what would you use?
Soap and water.
Okay, great.
We'll have our 3 swabs. We'll use 1 swab for one side of the external genitalia, 1 for the other side, and 1 down the middle. We'll take our catheter and insert it into the meatus. Advance the catheter 1 to 2 inches, and then once you see urine, you'll advance 1 more inch. As the urine is flowing into the bag, you want to notice the characteristics of the urine, whether it's diluted, concentrated, whether there's blood in the urine, if it's cloudy, if there's lots of sediment, if the patient had pain with the catheterization, or if you met resistance with the catheterization.
Great.
Once the urine has, you feel like the urine has flowed and you're getting towards the end, you want to perform the Coude maneuver, and you want to pinch. As you push, you want to pinch to make sure that there's no backflow, and you'll move from side to side doing the same thing both times. And you will remove the catheter from the patient and place it back into the bag. And you will tie off the whole catheter after you note the amount of urine in the bag for documentation purposes. Of course, you'll notify the physician if there were any abnormal signs, and you'll place the whole system in the trash. Go back to the patient, and you will take your soap and water wipes to get the iodine off. You'll take a wet wipe to get the soap off, and then you'll take a dry wipe at the end. You will redrape your patient and take your gloves and throw everything in the trash and re-sanitize your hands and go to the computer and document everything that you have just performed.
Okay. Great. Do you have any questions?
No,
Okay, great. This concludes our series. Thank you very much.